Okay, congratulations. We did it. Oh my goodness. Wow.
We figure it out.
Holy cow. I know, it's crazy. This is brand new for me. This is my first ever Facebook Live, and I just feel blessed that you are willing to join me on this crazy journey that obviously I'm probably not equipped to be doing.
Well, we're doing this together. It's my first one as well. So,
Awesome. Awesome. Okay, terrific. So I'm seeing there's a couple people on here. Maybe we'll give it a second or two to see if we get some more viewers. I don't know.
absolutely.
Yeah, I don't know exactly how. I think they just join in and that's that. I don't think I have to do
Yeah.
anything special.
Hi,
Like I did for
Sylvia.
you. You get the special treatment. Okay. All right, fantastic. So while we wait just a couple minutes, how's your day going?
So far, it's been very exciting. I'm here in Orlando. We're working the ILATS conference. So this is
Wonderful.
more focused for patients with Lyme disease and mold toxicity and things like that. So it's quite interesting to hear all what these doctors have to say and share. And yeah, learning a lot.
Absolutely. Oh, I'm sure that's going to be great information. You hear a lot nowadays about Lyme disease, so that'll be
Yep,
terrific. I can't wait to hear what you learn when it's all over.
absolutely, absolutely.
Fantastic.
Always excited
Fantastic.
to share the information.
Yes, absolutely. Well, I think we just lost one. I don't know how great we're doing here. Um, but we'll just do it. It's going to record. I can edit, and we'll at least have done one, and we can put that to rest and know that going forward, we'll know a little bit more each time, right?
Yep.
So we'll just get started. And I want to start by saying I am Karen DeBrango. I am the founder of Health Coach for You. I am a national board certified health and wellness coach, as well as a certified functional nutrition counselor, a certified gluten-free practitioner, and I am here as a health coach for you to introduce you to Sureily font and Vibrant Wellness. Before we get started, I do want to stress that we are talking today about functional medicine testing, and I nor Sureily are physicians. So keep that in mind. I am, however, an allied health professional. So as an allied health practitioner, I am partnered with doctors that are able to order these tests. These tests are not recognized by the FDA, and they are solely used for wellness and informational purposes. I just want to put that out there front and center. And with that, now let me introduce Sureily. Sureily, again, welcome. Thank you so much for taking time out of your conference to join us today. And please tell us a little bit about yourself and about Vibrant Wellness.
So I have been doing medical sales for over 10 years in different areas, selling different type of equipment, working alongside doctors, hospitals in some cases, providing different services or products for patients. I've been in the functional medicine world for about 7 years, 7.5 years now, in laboratory testing. So sharing information with all the providers out there that are interested in learning how to dig a little bit deeper, not just, put a band-aid over symptoms, but actually dig a little bit deeper. And that's what a lot of these functional wellness testing help these providers do. I'm also a health coach myself. So I've been through the training and the education. I did it mainly for personal growth, right? Just to learn how to better communicate about some of these issues that patients are dealing with, and how to help some colleagues, friends, other people that I come across, how to dig deeper and find their own answers. Because at the end of the day, that's what we're trying to do, right? Just be a guide to help them find their own answers. So
Absolutely.
having said that, I've been with Vibrant Wellness for almost 5 years now. Vibrant Wellness we are a functional wellness lab, but we consider ourselves more of a technology company. That's really where
Mhm.
our strength is. We have an amazing technology that allows us to offer a lot of testing out there, highly sensitive, highly specific. The great thing is we don't have to sacrifice any of that. But we're able to do it at a good cost. We're able to provide very comprehensive testing that really allows providers, doctors that are ordering these tests for their patients, allow them to really have a bigger picture as to what's happening with the patient. So Vibrant continues to strive to put new testing out there, push medicine forward, functional medicine forward, push providers to have to dig deeper to learn more. So we're in a very exciting time for our company. And again, I'm just happy to be able to be here with you, sharing a little bit of information on what we do.
Absolutely. Absolutely. And again, I'm thrilled that you're taking this journey, my first ever Facebook Live. So thank you again for the first few minutes getting through those glitches, but we got it. We can do it. Just to share with our viewers a little bit about my first experience with Vibrant Wellness, I had been very ill for quite some time. I was suffering from a lot of GI distress. I wasn't able to eat without getting sick, and I was struggling to figure out what the problem was. So like most people, I went to my primary care provider, and I was told possibly that I had IBS and just to take some medication when I ate and watch certain foods that I ate, and everything should work itself out. However, that wasn't the case, and I was getting more and more sick, and I was losing a lot of weight. I went to a GI specialist who did an endoscopy and some other testing and determined that no, you do not have celiac disease. So go forth, eat wheat, right? That's not the problem. So I went to an allergist. Maybe I have a wheat allergy. Did all the testing, not allergic to wheat. So still unanswered questions, still feeling very sick. And at that point in my life, I was not able to work. I was struggling intensely with just daily activity because I was so inflamed and so ill, again, with no answers. I went to a local nutrition store and just happened, well, nothing happens by chance, right? It's all divine intervention, but I met a certified gluten-free practitioner, and he had just finished a talk and was very generous and allowed me to sit down with him for 20 minutes to discuss any questions that I might have. And of course, the first one was, you're a certified gluten-free practitioner. What is that? And so he explained to me the training he went through under Dr. Tom O'Brien, and he talked to me about my symptoms and my non-results, right? I had no diagnoses. I didn't know what was going on in there. And he said, I have a way for you to figure that out. And he introduced me to Vibrant Wellness and to the Wheat Zoomer, which we will talk about today. And through that testing, I was able to discover that I had leaky gut, which was causing a lot of food sensitivities and a lot of other issues in my body. But I also have a non-celiac gluten sensitivity. And that was not something that my allergist nor my GI doc were able to dive deep into with me. They told me that I didn't have celiac and I don't have a wheat allergy, so therefore this is not the problem. But yet going through Vibrant Wellness and learning about the Wheat Zoomer and figuring it out really lit a fire under me, because once I knew the problem, the root cause, I was able to address it and I was able to turn my health around. And so here I am today, feeling better and fabulous at 50 than I did in my 30s and 40s. And I'm super excited to be sharing with you all about the Vibrant Wellness Wheat Zoomer. So Sureily, could you tell us a little bit about this test and what makes it so special?
So the Wheat Zoomer was one of the very first tests that our company launched. It has been a game changer for many practices, many providers, and many patients that have had the opportunity to try it on themselves. These tests is a very comprehensive test. It looks at a couple of different things that are important for any patient that's having any kind of wheat issue, right? Obviously, the first thing that we're going to look at is going to be celiac. We have to be able to rule out celiac. We have to be able to identify if the patient has celiac antibodies. So yes, a lot of times GI specialists will do an endoscopy or some sort of scope or test to see if they can visualize, right? Go in and really see, sometimes do a biopsy, things like that, to be able to diagnose a celiac patient. With the help of the Mayo Clinic, we were able to do a study with with 100 positive celiac, biopsy confirmed celiac patients, and we were able to identify antibodies 100% of the time. So that's one of the strengths of this test and the technology that Vibrant has. We're able to feel very, very confident that the information that our test is providing is very accurate and it's actually going to answer a lot of questions. So that's part of the test that that's one of the parts of these tests, is the celiac aspect of it. So once you're able to see if the patient has antibodies or not, that can help the provider, right, determine the course that they're going to take with the patient. But in addition, we have another marker that's unique to our company, is a fusion peptide marker that actually can help identify the progression towards celiac disease up to 4 years before the patient even have celiac antibodies. So that's looking deeper at the microvilli damage. You know, it's looking at potential damage that could be happening even before it becomes a problem. So now we're looking at markers that can really make an impact in the patient's life, right? Because if you can see this before it really becomes a major issue, you can make the appropriate lifestyle changes that you need to prevent, or at least slow down that progression as long as you can. So that's another component of our test. As you mentioned, leaky gut or intestinal permeability, there's a lot of information out there about it. There's a lot of questions that people have about it. So Vibrant has a very comprehensive view. We're looking at different markers that can look at the tight junctions, can look at actual damage at the mucosal level. It looks at the gram-negative bacteria, or the LPS, I should say. So potential overgrowth of gram-negative bacteria, or LPS, which is a powerful endotoxin that can cause inflammation and can affect patients in different ways. So we have a lot of very important markers that can give you and give the provider better direction of where you're going to go next, where your problem could be stemming from. And then lastly, we're looking at the protein of wheat, but we're breaking it down to the peptide level. That has been one of the disadvantages of the testing that has been out there so far. A lot of these testing are only done at the whole protein level. So, but normally, right, when we're eating this food, we're supposed to be digesting this food all the way down to the peptide level. So if you're only looking at whole proteins and you're not looking at the peptide level, you could be missing patients. So not to put down any of these other tests out there, they have been great, right? They've been able to help a lot of people a lot of time, but medicine and these type of testing should continue to evolve. We should be able to do better, and that's what Vibrant is trying to do. We're now looking at peptide level testing for a lot of different foods. So we started with wheat, but we're doing it with a lot more foods to be able to really dig deeper and identify what foods could potentially be causing some problems for the patient. So that's in a nutshell what the wheat tumor is doing. Of course, we can dive a lot deeper and get very, very clinical, but I don't think we have much time for that. So
no, we don't have a lot of time for that, and we don't want to certainly be over the heads of most of our viewers, but I think it's fascinating that they're able to break it down to such a minute level so that we can help scoop up those people that were like me in that sort of gray area, right? Because there's no total villi flattening, which is the hallmark classic denotation of this is celiac disease, right? They go in, they do a biopsy, and your intestinal villi, and for those that don't know, in your small intestine, you have the villi, which are kind of like the shag carpeting, if you will, and they become completely flattened, 100%. And that is a hallmark of celiac disease. But what about those people that are maybe only 30% or 40%? And so what Sureily is telling us is this test has the technology to be able to detect prior to a full-blown case of celiac that you are heading in that direction, and then with the help of the appropriate clinicians able to then work to resolve the issue, hopefully circumvent the problem before it becomes a full-blown disease or an autoimmune condition down the line too. Because as we're talking about leaky gut, if we don't address leaky gut, we know that that can then in turn lead to food sensitivities and other autoimmune conditions. So Sureily, I know that Vibrant offers food sensitivity testing. Tell us a little bit about the food sensitivity versus the wheat zoomer. And I guess specifically my question is, why would it be more beneficial for someone to start with the wheat zoomer versus going towards a food sensitivity test?
So I will start by saying that one of the most important things I think patients or people need to recognize and know is what level of knowledge does my provider, my doctor has in interpreting and utilizing the results that I'm going to get in these tests to really be able to help me. And I think that's where a lot of people are missing, because there's a lot of companies that are now offering direct to consumer tests, right? You see all these advertisements all the time that you can order your own test and you can, see what foods you're sensitive to and all these things. But if you are not understanding your entire clinical picture, it's very hard to really just say, oh, I'm sensitive to coffee, I'm going to stop drinking coffee, or I'm sensitive to broccoli, I should stop eating broccoli. Like, should you really? Like, is that part of your clinical picture? Is that truly what's happening? So I
Right.
think that's where I would like to start. So before people start looking for testing, make sure you have a provider that is on the same page as you and that actually understands and knows how to interpret and use these tests for you. That's one of the advantages that Vibrant has. We want to work with providers that know how to understand, how to interpret, and how to use these tests and these results to really help the patient. Now, having said that, Vibrant has a very comprehensive portfolio. As I said, you have different types of food sensitivity testing you can do. You can do whole protein testing, and you can do peptide level testing. So whole protein testing is, in our world, in Vibrant's world, is what we call the food sensitivity panel. So with us, we usually recommend that the patient bundles them together. You want to be able to see both. Both tests, whole protein and peptide level testing, are going to give you great pieces of information. So you don't necessarily need to discard one completely. You just need to understand exactly what you're looking at. So when we have a food sensitivity panel, we're looking at 96, for example, 96 different foods. We're looking at different immunoglobulins that could be produced against these food proteins. So the provider needs to be able to interpret this for you and share with you why that could be happening and how you can better address that. But at the whole protein level, if that's all you're looking at those food sensitivities, you could be missing either cross-contamination, you could be missing food that you are digesting all the way down to the peptide level. And that's where the wheat zoomer or dairy zoomer or all these other zoomers that Vibrant has come into play. So I'll give you an example. I had a provider in Sarasota that she had a patient that the patient knows she's celiac, has known for over 20 years. So the patient has been very, very strict with her diet. She doesn't eat out, she cooks at home. She's been able to maintain or control that condition that she has, right? Because she's been so strict. But all of a sudden, the patient was starting to experience some symptoms, and they wanted to see if by any chance she was getting exposed to wheat. So they decided to do a wheat tumor. That would have been missed with a regular whole protein food sensitivity testing that is just looking at a portion of the gluten protein. In the wheat zoomer, we're looking at the gluten and the non-gluten proteins in wheat, right, at the peptide level. So the patient did the test and there was reactivity. So she was getting exposed somehow. So the patient went back home like crazy, trying to search, figure out where she was getting it. She had gotten a new bird, and she was getting exposed through the food that she was feeding these birds. She was touching it, smelling it, right? She was getting exposed through that because, as we know, wheat is everywhere. Like, we can find, wheat components everywhere.
Absolutely everywhere.
Yeah. So that's one of the advantages that these type of testing can have. It can help you really identify situations in which you're getting exposed to these foods that you're trying to avoid, if you are trying to avoid them. And if you're not, it can help you identify if you should be avoiding it. So
if you should be avoiding them. Right, exactly. I always say it's a good way to find out your body's relationship with gluten. And I specifically focus on gluten as a certified gluten-free practitioner. And a lot of what I do in my health coaching practice, I work with a lot of patients with celiac disease. I work with a lot of patients that are on the gluten-related spectrum disorder and are newly diagnosed and are saying, but I'm following, like you said, like your example, the lady in Sarasota, I'm following a gluten-free diet. I'm still suffering from symptoms. I don't understand why. And part of my coaching is to really help them take a deep dive into what are they doing where there's possible cross-contamination. And you don't always know. You think you're being as vigilant as possible. And one example I would have is just in tiling. I helped my younger sister tile her son's bedroom. My husband and I went over as reinforcement, right? And we're getting ready to tile, and we're all sort of picking out what it is that we're going to do, kind of make an assembly line sort of project out of this. And the first thing that pops into my mind is there gluten in the quickset, in the materials used to stick the tile to the floor? And my sister and my husband both looked at me like I'm crazy, because how could there be gluten? Like, you're not going to eat this. Why is this a problem? But I likened it to the same thing as flour, right? So we know that wheat flour, when we're cooking, can actually stay in the air for up to 24 hours. And so that inhalation or touching, like you said with your lady down in Sarasota, just having that proximity exposure can be enough for people that are super sensitive. And with the same mindset, I Googled to find out what's in the quick set, and lo and behold, there's gluten in there. So obviously that wasn't my job for the day.
Yeah, absolutely. Let
Right.
me clarify, the provider that I was working with is in Sarasota. So just so you know,
Yes, yes,
not
yes.
not the patient, the provider. But
Sure.
anyways, yes,
Absolutely.
absolutely. We can definitely get exposed in many different ways. And, that's part of the educational process, that somebody like you can help patients, or people identify where they could be getting exposed. So a lot of times our doctors, our MDs, nurse practitioners don't have the time to sit with us and give us all these detailed information, right? So that's
Right.
where
Right.
health coaches like you can come into play and really help these patients identify potential exposures, how to read the labels, how to identify if I'm getting exposed or not. And it's like what I always say, it's everything is in balance. The problem is when we're overexposing ourselves all the time to all these different agents, it just gets to a moment that it might be a little bit too overwhelming for our bodies. And maybe one day I'm able to handle it, but maybe the next day my body's just doesn't want to deal with it. It's just not ready to deal with it. So
Absolutely.
how do you prepare? How do you start getting to know your body? How do you know what kind of things you are ready to get exposed to or not, or you even want to get exposed to or not? Is it even worth it, me getting exposed to it or not? And this is
Right.
all part of the educational process that we need to take ownership of, because unfortunately we can't depend on our medical professionals out there to give it to us. Not because a lot of them won't want to, it's because a lot of times they don't even have the ability to do so, right? They're so busy, they have so many things going on, they have there's just so much time they can spend with us. So that's where people like you come into play, to be able to provide a little bit of additional education on what we should be looking out for, in order to make sure that we're at least doing the best we can to keep ourselves from getting into too much trouble, right?
Exactly right. I have a wonderful practitioner that I work with here in my area of town in the Tampa Bay region, Dr. Narula, and he's a GI doc. He is fantastic with sending me his patients, and they're newly diagnosed, and they're like a deer in headlights, right? Because they've been eating gluten for their lifetime, so decades. And now all of a sudden they're being told, no, you can't have this anymore. And just racing out to the store to buy a
Yeah,
gluten-free labeled product is not the answer. And
yeah.
so through my coaching, I'm able to help them understand, how do I properly set up my kitchen? How do I make sure that I lessen the possibility of cross-contamination,
Hmm.
right? And a simple example of that is my gluten-free toast in the family's gluten toaster is no longer gluten-free toast, right? So
Hmm.
something that simple. And we
Yeah.
walk through, how do I set up my food prep? How do I set up my kitchen, my storage of my food, the cooking of my food, while I'm also potentially cooking the rest of the family's food, right? So gluten-free pasta versus pasta. I'm not sharing utensils. There's a whole education piece there that the doctors and the providers don't have the time to be able
Hmm.
to dive into. And so working with health coaches, we can hold their hands and help them adopt this lifestyle change, right? It's a mind shift, it's a lifestyle shift, and it's not a diet, because why would we do anything
Hmm.
that starts with diet?
Yeah, and let's be honest, a lot of our providers, if they're not cooking themselves, they wouldn't
Right.
even think of not
Sure.
using the same utensils or the same, those are
Exactly.
things that it's not until you are actually living through it and you are having to think of all these minute details that you wouldn't even consider. So
Exactly.
that's
Exactly.
where a lot of these education is very helpful for people. And what we need to understand is each person is different, right? All of our bodies are unique and are different, and the way we or other inflammatory foods or other toxic elements, right? It's not just wheat, it's a whole array of things that can put
So many.
burden or stress in our immune system. But the way I would respond to it is not going to be the same way you're going to react to it. It's not going to be the same way my neighbor or somebody else will respond to it. So that's where, again, as I was saying earlier, we need to take ownership of our own education, start learning and understand how to listen to our bodies and how to
Sure.
dig for some of these answers ourselves. And that's where Vibrant Wellness is trying to do the best we can to put out there as many tests as we can that can really help each individual go through this journey with their providers into digging deeper and digging deeper. And, you know, I find it funny because you talk to people about their pets, right? And they say, well, I just had to take my dog to the vet and I just spent $300 in testing. But then when it's time to spend the testing on themselves, they think about it twice. So I think we need to really take a step back and set our priorities straight. And maybe you're feeling okay right now, maybe you're feeling, you know, healthy right now, maybe now is the time to dig a little bit deeper. Is that something that I should be aware of, something happening? Is there a genetic predisposition? Is there a potential nutritional deficiency that I should address? Is there a potential
Absolutely.
sensitivity that I should be looking at? And not wait until you're too deep into the hole to try to dig yourself out, right? Like now is the
Right.
time to start doing all these tests and slowly budget it, right? Plan it, right? You don't have to spend all this extra money if you don't really need to, but make sure you're taking care of yourself. Make sure you're getting to understand your body, read your body, so that you can at least try to live as healthy as you can for as long as you can.
Sure, absolutely. That's perfectly said. And to use my own self as an example, had I known about Vibrant Wellness and the Wheat Zoomer
Mhm.
years prior to when I actually learned about it, I would have been able to circumvent a lot of disastrous
Mhm.
um, health circumstances that came, I would say, as a direct result of the inflammation.
Mhm.
And just to clarify what I'm saying, so in addition to struggling with eating and having a lot of GI distress, joint pain, nausea, weight loss, a lot of the typical symptoms from a gluten-related disorder, I had migraines, brain fog, so many symptoms fall under that umbrella. But also, I was struggling with autoimmune disease that was also undetected. What was happening is the two were kind of fighting in my system. The inflammation was brewing and becoming so overwhelming that eventually I went into a full-blown cytokine storm, which sort of sidelined me from my life for 2 years until I was able to get to the root cause of how do I solve some of these issues? How do I go about them in a holistic manner? How do I look and address my diet? What do I need to discover? And it was in that time off where I met this CGP, the certified gluten-free practitioner, and I learned about the wheat zoomer. So again, had I had that knowledge before things got so inflamed and so out of control and more symptoms, I might have been able to circumvent sort of being sidelined and that cytokine storm. You know, 2020 is always what they say about hindsight, right? So, but now
Mhm.
going forward, I have increased my education. I have done the due diligence. I was so intrigued by what that CGP taught me that I went out and signed up to become a CGP myself because I literally, like, I wanted a brain dump. Like, put that knowledge in this brain, please, because that would have helped me so much if I knew that
Mhm.
information years prior. So,
Mhm.
definitely yes to everything that you're saying. And this has been so fantastic. I hope that people are getting something out of this and that they do realize that, yes, it might be an investment, but it's an investment in you. And guess what?
Mhm.
You are worth it. And
Mhm.
your health is worth it. And I would have spent every dime that I had to get those answers sooner so that I would not have been sidelined from my own life, so that I wouldn't have suffered the way that I did. And like I said, now I have it under control. I know what the issue is. My autoimmune condition is in remission, which is just amazing to me, just
Mhm.
simply from healing my gut and knowing what the issues were in my body's relationship with gluten and being able to identify that and eat properly and avoid the cross contamination and all of the things that I work with my clients about. I just think it's super imperative that people have this knowledge and they realize that you don't have to stop with just like, if I had, you don't have celiac, you don't have a wheat allergy, but I'm a have questions, gotta find the answers kind of girl. So
Mhm.
I kept digging and kept
Mhm.
digging, and here we are. You are your own patient advocate, and no one's going to advocate for you better
Absolutely.
than you, right? And I know you can
Absolutely.
agree with that, Sureily, definitely.
Yeah, no, absolutely. That's And and more we're seeing patients that are or people, right, clients that are doing that, are trying to advocate for their own health, are trying to dig for information, and the providers get upset because they're coming to their practice with all these advanced questions that they don't necessarily want to get into and answering. But
Right.
that's when you know that you are at least trying to take some ownership on your own health. And yes, there's a lot of information out there on the internet that is not necessarily going to be the best. It's not necessarily going to be helpful. It might just confuse you a lot more than help
Right.
you. But there is
The
still a
rabbit
lot of
hole.
good, right? But there is still a lot of good information out there. So it's just finding that balance of digging and then finding the right provider that is willing to walk you through that journey of identifying the things that are going to be important for you to be able to have a healthy, strong, healthy, life. So I think it's
Absolutely.
a combination of things.
Absolutely. Well, I think Vibrant Wellness, I mean, you guys are the best in my opinion. Obviously, all my praise to
Thank
you
you.
because it definitely changed my life and it turned some things around for me. And I know that it can do the same for many of our viewers out there. And I hope that they all have learned something from this valuable interaction between us today. And again, Sureily, I thank you for taking the time to be here. I know you're a busy lady, got a lot of things going on. I do want to thank everyone for tuning in today and listening to my chat with Sureily Font of Vibrant Wellness. And we've been talking about the Vibrant Wellness Labs and specifically the wheat zoomer, as well the food sensitivities. Anything else you'd
If
like to add, Sureily?
Yes, I will just say, if anybody that's watching this wants to know which providers in their state, in their city, in their area are signed up, are approved providers to be able to order through Vibrant Wellness, just give our company a call. You can Google our company, either Vibrant America or Vibrant Wellness, and call our support team, or just send us an email and we'll try to guide you to find providers in your area that can order these type of testing for you.
Absolutely. That's wonderful advice. Thank you so much. And again, just to add my disclaimer that I said at the top of our hour, please remember that we are not physicians, but we are here to offer this information as support in your healthcare journey. And as a non-medical allied health practitioner, I am partnered with doctors as well that are able to order these tests. So you can certainly reach out to me on my website too. These tests are not recognized by the FDA, but are solely used for wellness and informational purposes. And of course, that's our disclaimer. We know that they work. I know personally that they work. If you'd like to talk to me more about my journey through this, feel free to reach out on my website. Until next time, friends, we appreciate you jumping online. This is part of my gluten series. There is more to come. And at the end of the year, on December, end of the year in December, I will be meeting with Dr. Tom O'Brien. He has asked me to participate. I will be getting some more information coming. We're solidifying our date and time, and we will be talking about all things gluten. Dr. Tom O'Brien is a wonderful guru of all things gluten and also the head of the CGP program, the Certified Gluten-Free Practitioners, and I have met him personally. He is an amazing human being and an amazing functional medicine doctor, and we will be talking all about all things gluten, and in addition, my book, which is now available on Amazon. For those of you struggling to go and stay gluten-free, this book is for you. It's 30 Days to Gluten Freedom, and more on this will be coming too, so stay tuned. Until next time, friends, thank you.
Thank you.
Bye.